Maggie, we're going to go ahead and get started with your cranial nerve assessment today. So I have a couple of things that we are going to go over, and it does look like I actually have you in for some specific testing today. Okay, all right. So why don't we get started? Obviously, I have your first name as Maggie, so that is confirmed. Now, your diagnosis is to be determined, excuse me, but I did see that we've had a recent injury.
Yes.
Okay, all right. So, are you feeling okay to proceed with testing today? Are you in any pain right now that requires medication?
No, I'm okay right now.
Okay, all right. If that changes at any point, please do let me know. All right. And then just for emergency purposes, I have you down as a full code.
Yes.
Okay, all right, good. Any issues with your current physical state as far as like ambulation? Are you able to get dressed and perform all of those things independently?
Yes, I can.
Okay, so activity of daily living level has not changed. And I don't have that you're currently on any prescription medication.
Right.
Good. So as far as your recent medical history, have you been ill recently? Anything like cold, flu, viruses, that kind of thing?
No, pretty healthy.
And no symptoms of like allergies, stuffy nose, issues with your ears?
No.
All right. Any headache or migraine?
No.
And any recent injuries? I did see that there was some sort of fall.
Yeah, so I was running the other day and I did fall and catch myself with my right hand.
Okay.
I've been feeling some loss of sensation in my hand since then.
Oh, okay.
Which is kind of an issue because I work on the computer from home.
Got it. And how did you notice the loss of sensation? Is it you're like kind of touching things, you feel that?
Yeah.
Okay. Any issues with your strength in that hand, like weakness of the limb?
A little bit.
Okay. So we'll definitely test that. And that's not something that you ever experienced prior to this injury?
No.
No. Was there any open wounds, open cuts?
No, just scraping.
Scraping, okay. So did you see a doctor by chance? Nothing that you felt was like broken or anything like that?
No.
Okay.
I don't think I broke a bone.
And you said that was about a week ago?
Yes.
Do you feel like the symptoms have gotten worse or kind of steadied?
I think they've gotten a little better,
Okay.
but I'm just worried about the sensation aspect of it.
Okay, so we'll definitely have a look at that. And you said that was your
My right hand.
Okay, all right. Straight upper extremity and nothing on the left. When you fell, did you hit your head at all?
I did not.
And there was no loss of consciousness whatsoever. You stayed awake the whole time. Okay.
Yes.
And was this a witnessed fall or just unwitnessed? Were you by yourself?
I was by myself.
Okay. And you were able to make it back home okay?
Mm-hmm.
All right. And I'm sorry, you said this was a bike? You fell off your bike?
I
Or
was
you were
running,
running? You were
actually.
running.
Mm-hmm.
Okay. Running. And did you continue to run home?
I did.
Okay. So you were okay and that you didn't feel
Yes.
dizzy or anything?
Mm-hmm.
All right. Good. And since then, no issues with like blurry vision or anything like that? No dizziness,
No.
nausea? All right. Good. So you said you feel like you have some numbness. Any tingling? Are you feeling like pins and needles? Or, you know, like when your leg
Yes.
falls asleep, you kind of feel static? Anything
Mm-hmm.
like that?
There was, especially when it first happened, there was
Okay.
some tingling.
Let's definitely look at that. Have you noticed any temperature variation of the limb itself? Has it felt particularly warm or colder than normal? Or colder than the other side, warmer than the other side?
I think a little colder than
Colder?
the left hand.
So maybe some circulatory issues happening there. We definitely need to look at that. Is it causing you any pain or discomfort? Any tenderness? Does it hurt?
No, it just feels strange.
Just feels okay. So you can just tell that something's not quite right
Yeah.
there. All right. Can you show me about how did you like land on your wrist? Was it your palm?
Yeah, probably palm and wrist area.
Okay.
Like reached out.
And was
just
this
happened to-
concrete or grass?
Concrete sidewalk.
Okay, so a pretty hard fall.
Mm-hmm.
Did you trip over anything or just lose your balance?
I think just a crack in the sidewalk. When
So
I was
just
running.
unfortunate timing.
Mm-hmm.
Were you wearing proper footwear, tennis shoes?
Yes.
Okay. And you're not typically prone to falls, I assume, if you're running regularly?
No.
Right. And you don't find that you've been particularly clumsy recently?
No, not
Okay.
particularly.
Just making sure, just trying to assess whether or not this was like some sort of neurological event or
Yes.
it was just truly an accident and you just fell. So
Mhm.
all of that is fine. All right. And then as far as your senses, since I will be performing a basic cranial nerve exam, really we're testing for neurological dysfunction here, specifically with something that sounds like neuropathy or sensation loss. So any issues with your sight or your eyes?
No. All good.
Do you wear lenses or glasses?
I do wear contact lenses.
Do you have lenses in now?
I do.
And you feel like you can see appropriately?
Yes.
Right. And as far as your hearing, any issues with your ears or your hearing?
They're all good.
And sense of smell, do you find that you ever have a deficit there?
No.
And no occlusion of the nair, you feel like you can't breathe?
No.
And how about your sense of taste? Have you noticed any changes there?
No.
Obviously your sense of touch we are focusing on today. Okay. Alright, so it's the right. And I will kind of map out here. Do you feel like any of that numbness or tingling radiates up the ulnar region here, or does it stop at the wrist?
Yeah, it kind of stops at the wrist. Maybe up a little bit here, but yeah.
Okay. And is it isolated to one side, or is it very central?
Mostly central, yeah.
So to the palm?
Yeah.
Okay. And then dorsal side as well, or mostly just on the palm?
Mostly the palm is where the impact was.
Okay. All right. Okay, so I'm obviously going to perform a physical inspection there. So before we do that, I'm going to do a brief neuro exam. So this is just, you can relax your just a test for your neurological functioning, make sure everything is going well. So can you tell me what you had for breakfast, if anything, today?
Sure, I had egg whites and toast.
Egg whites, very healthy choice. Nice. Do you remember what you had for dinner last night?
Ooh, I had poke and rice.
I love that choice as well. Very nice. Okay. And can you tell me what day of the week it is?
It is Friday.
It is Friday. Very nice. And can you tell me where you are right now?
I am in California.
Good. And a little more specific, are you like at a grocery store, at a doctor's office, at your friend's house?
Doctor's office.
Doctor's office. I know that seems like a rather silly question, but thank you very much. And if you can tell me who I am in relation to you.
You are a doctor.
Right. And I did see that you have this is emotional support cat, Bruce?
Yes.
Okay, all right. Well, he's welcome in the office. Absolutely. I'm just going to notate that down. So if we have you in the office again, they know to expect that we will have an animal in office. It's totally fine. I actually encourage it. If my patients have emotional support animals, I do like them to come into the office. It tends to make the visit easier on both of us, so that is totally fine. He's very well behaved.
Yes, he is.
All right, so I'm going to ask you a couple basic questions, Maggie. These are really very simple arithmetic, very elementary, nothing that you need to stress about. I'm going to ask you them verbally, and I'll ask you to try to calculate for me.
Okay.
So can you tell me what 9 plus 5 is?
14.
Good. And 5 plus 4?
9.
Good. And 14 minus 9?
5.
Very good. So all of that is fine. All right. Now I have a couple shapes written out here, or drawn out, I should say. Excuse my terrible drawing abilities. I'm going to point to it. I'd like you to just indicate what the shape is. So this here.
Triangle.
And here.
Square.
And here.
Circle.
And here.
Octagon. Hexagon.
Okay.
One of those.
That is an octagon. Very good.
Okay.
All right. I am going to ask you to read these two words.
Assignment sheet.
Good. And here.
PT name.
Good. And here.
PT doctor.
Good. Okay, so that's patient name, patient doctor. Very good. I'm going to hand you this pencil, whatever side you typically write with your dominant hand. I'd like you to write a very short sentence for me here on the bottom. So just a couple words.
My hand feels a little weird.
You can tell that even with writing, you feel a bit of a deficit there.
Mm-hmm.
Okay. And is that a dexterity issue? I'm going to set this down, excuse me. Is that a dexterity issue in that you feel like you're having trouble controlling the pencil, or just the writing itself?
It just feels strange to hold the pencil.
Okay.
Like it only
doesn't feel
in certain
natural.
parts. Yeah.
Okay. All right. Interesting. Okay. So let's go ahead and begin with our physical assessment then, because I am fairly concerned about that. We will do the sensory portion of your examination last. So I'm going to test for your other cranial nerves first. So to start with, Bruce is so cute. To start with, I'm going to test your visual acuity, visual field, that kind of thing.
Okay.
So I have a pen light here. The light is fairly bright. So I am going to ask you to look into the light. Not to start with, excuse me. I'm going to have you keep your head midline for me. And then I'd like you to focus on just any point across the room.
Okay.
So I'm going to just test first for your corneal reflex. So, sorry, testing for your pupillary reflex here. So testing for normal constriction and dilation of the pupil. So essentially whether or not it grows or decreases in size as I bring my light into your visual field, which is equal. Very good sign there. Any sensitivity to light with this?
No.
Good. So I'm going to perform what's called a swinging light test, and then I'm literally going to swing my light like a pendulum. So same thing. I'm going to have you look actually at my hand here.
Okay.
Very good. Okay. So now I'm going to ask you to follow the light with your eyes. I want you to keep your head fixated, and you can move your eyes to track the light. Okay. Good. Not noticing any rigidity of the eye movement. Fairly smooth and equal. Do you feel any pain or discomfort as we rotate here?
No.
And if I come in, does that cause any double vision or blurry vision?
No.
Good. Okay. Very good. I do want to test. Now you said you wear contacts. When is the last time you had those tested for accuracy? Have you seen your eye doctor recently?
About 8 months ago, I would say.
Okay, so fairly recently, not too far away.
Yeah.
And was your prescription up to date, or did they need to update it at all?
It was up to date.
It was. Okay. So I have a Snellen chart here. I'm sure you're familiar with a much larger version at your optometrist office. So I'm going to hold this out at about arm's distance as it is a modified chart. I'm going to point to a couple of letters. I'd like you to try to read them aloud. Okay. Firstly, can you see the chart here?
I can.
Okay. And this letter here?
E. F. P. F. D. O.
Can you read that smallest line?
L. T. F. P. H.
And if I ask you to cover one side, can you try to read that smallest line for me?
L. T. F. P. H.
And if you switch eyes, I'm going to have you read the line backwards if you can.
H. P. F. T. L.
Good. Okay. So no deficits there. Have you ever been tested for color deficiency or color blindness?
I don't think I have.
Okay. It's not usually tested on annual unless you're, saying that you're experiencing something. So I am going to go ahead and do a very brief test of it today. These are Ishihara test plates. This first one is a test, so you should, in theory, be able to see that there is a number here. If you can read that number aloud for me.
12.
Good. So I'm just going to flip through here and we'll test for your red and green. So do you see a number there?
8.
In here?
5.
Good. And so a little bit harder here.
7. 45.
Very good. And then lastly, I'm going to show you a pattern. And there are 2 X's here. I'd like you to try to use your dominant hand to trace from one side to the other.
Okay.
Good. Now that tests both for color deficiency and for your dexterity. Did you feel like you had difficulty with that?
That was okay because it was just my finger.
Okay. So feeling less of a deficit in the digits for sure. All right. Just going to set this aside. So your ocular health appears to be intact. We can go ahead and move on to your sense of smell. Now, do you have any allergies or sensitivities to anything specific?
I don't.
Okay. And no issues with any sort of natural fragrance?
No.
Okay. Just making sure. Don't want to make you feel ill. I just have a couple things here that I'm going to have you smell for me. So this one, you can keep your eyes open. Tell me if you can smell anything here, and if so, what does it smell like?
Alcohol.
Rubbing alcohol, yes.
Rubbing alcohol.
So I will give you just a second to breathe that out, and then I have two other things here that I'm going to have you smell, and for these I will have you close your eyes.
Okay.
Now these are fairly common scents, so it doesn't have to be super specific, just kind of give me an idea of what you think it is. And for this I'm actually going to close one side of your nose, so we'll start on this side. Now you take a gentle breath in.
Citrus.
Very good, that is citrus. We'll do the same thing on this side. And gentle breath in.
Smells sort of fruity. Can I try again?
Sure.
Ooh, that one is up. I'm not sure.
Okay.
To be honest.
Let's try with both of your nostrils just
Okay.
non-occluded here. So just take a regular smell for me.
It smells good.
That's okay.
It's so weird that I can't place it.
You can go ahead and open your eyes. That is actually peppermint oil, so peppermint essential oil.
Okay.
Yeah. That's okay. Very familiar, but a little hard to place, so that's totally fine. I don't suspect that you have any issues really with your sense of smell.
Okay,
I am going to test your sense of taste, and that will kind of, they are very connected, so we'll test both and see how you do. So you said you don't have any allergies. I have a couple things I'm going to have you taste here. They are very different. Neither one is particularly unpleasant.
Okay.
I would like you to just sip. You don't have to drink the whole, there's not a lot in there, but.
Okay.
And we're just looking for a general taste.
Salt.
Good. Apologize for the salt. We'll try that one.
Apple juice.
Good. Very good. So you did really well there. All right, so we can go ahead and move on. Why don't we test your sense of hearing? And you said you don't typically have any issue there. Let's see. My medical assistant must have removed my other tool. That's okay. I will use this. So I'm going to test basic sense of hearing. I'm going to use this little pipette to make a sound. Now you should be able to hear this.
Yeah.
Good. So I'm going to ask you to close your eyes. I want you to just tell me if you hear it on the left or on the right side.
Okay. Right. Left. Right. Left.
Different sound here.
Left. 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 Center.
Good.
Right. Center. Center. Both.
Okay. Couple variables there, but nothing that was very extreme. You did fairly well. The center can be a little bit confusing.
It was like right center.
You did good. Okay. All right, so I'm just going to take a couple notes here. So we tested your visual acuity as well as your ocular health. That was okay. And then sense of hearing, sense of smell, sense of taste was all good. All right, so. Okay, all right, Maggie, so we can go ahead and move on to your sensation. Now, we are experiencing quite a deficit in that hand, so I think if you're comfortable, I'm actually going to have you lay down on the table. All right, Maggie, we are going to go ahead and start with the sensory perception portion of the exam. Now, I do want to focus on this hand. As you said, this is where you're experiencing most of that deficit. So I'm just going to feel around initially, actually, to see if there's any signs of like swelling or anything that looks concerning there. So, love this little ring. It's very nice. Is there any pain or tenderness as I palpate here?
A little tenderness in that. Yeah. You might still be healing in
Does Does it come up towards the fingers?
No, it's more palm and a little wrist.
And is it isolated to one side of the palm or both sides?
No, it's both sides, really.
Feel anything particularly swollen? I am just going to feel the joints individually here and see if there's anything that feels abnormal there. I do feel a little bit of rigidity in the fingers, actually. Are you able to rotate up the wrist? Does that cause you any pain?
No pain there, I don't feel, no.
Okay. And if you spread your fingers, is that painful or uncomfortable at all?
That's okay.
And if you bring in to make a fist?
That feels strange because this feels a bit numb.
Okay. I'll have a look with my light. I want to see the bone of this numbness. Actually, I do see just a little bit here. Kind of at the base of your thumb. Very slightly swollen there. I'd also say that your hand is just a touch cold at the palm. Do you typically have issues with circulation, or?
I do, yeah. My hands tend to be on the colder side, and feet.
And feet, okay. Got a little bit of bruises here and here. Just a little bit of swelling here. You've got a pocket of fluid there, which could be just a normal part of the healing process. Now look at the back side as well. And you said this side is not nearly as affected as the other.
No.
Just going down the joints, making sure there's nothing in between the joints. And the restrictions. You just squeeze my hand for me. Does that cause you any pain?
Not pain, no.
I do feel quite a significant difference in your first two fingers versus your last three, though, so that is interesting.
Okay.
If I could have you squeeze on this side, and then at the same time. So definitely noticing a deficit here in these last two digits, so that is interesting. I want you to just kind of let your fingers go flaccid. I'm just going to test for rigidity, your lack of mobility here. See if these two are just a little more flaccid than these two here. If I have you relax your hand here and just relax the full weight of your arm in my hand, I'm just going to. Reflex is still intact. Any pain there?
A little bit.
A little bit. Okay, my apologies. I just making sure. And was that pain in the wrist, in the hand, or in both?
In the wrist.
I'm going to have you just kind of look straight ahead for me. I'm going to drag this across your hand. Just going to see. Can you feel me touching you?
Not very much, to be honest.
Definitely a delayed neurological response there too. Okay, all right. Relax for just a second. All right, I'm going to test a couple of different things then because I am just slightly concerned. So let's start with something that you should be able to feel pretty distinctly. Excuse me. So I have just a this is a sponge applicator. So you should be able to feel that that's just slightly scratchy.
Yes.
And if I test on the seemingly unaffected side of your hand, can you feel this here?
I can feel that.
And does that feel what you would consider normal?
Yes.
So if I test with the thumb,
that's okay. I can feel that. That's fine. All good. Yep, that's feels.
So I think we can say pretty definitively that the back of your hand is okay. So I'm going to do the exact same thing on this side.
Okay.
So is it comfortable for you to hold your hand here?
Yeah.
test firstly at the wrist. I'm actually just going to roll your sleeve. Is that okay?
Sure.
If I start here, does that feel pretty normal?
That's okay. Yes, I can feel that.
If I come up here,
Yes, that's normal.
mm-hmm.
That I can't feel as much. Feels very soft.
Okay. So if I come up, let's say like this, can you tell me when it starts to feel abnormal to you?
Yeah, right here, about right there.
And then if I come just directly up the middle, when does this start to feel abnormal to you?
Like right there.
Okay, so that's closer to the wrist area. And then if we do the elbow here.
Okay, right there about.
Right. And then on the back side, does it feel any different as we come closer, or that just all feels the same?
That feels fine. Yeah, it feels the same.
So then if I come in, can you tell me when it starts to feel abnormal here?
Right there.
Right. And then on this side?
Right there.
Perfect. So we've got a pretty square section here. Let me see what's about. I'm actually just going to use this. Got some marks here that I can measure it. So about 4.5 centimeters. 4.5. And further right. And about half. Okay. So just looking for what specific dermatomes might be affected here. So now I'm going to have you close your eyes for me. I'm going to touch you with the same sponge object. So again, you should just feel, kind of a soft scratchy material. I'm going to touch you with it in various places of the affected area. I want you to just either say yes or nod your head. Just indicate to me when you can feel something.
Okay. Yes, but very faintly.
Okay.
Yes. Yes, but faintly.
Does that feel okay?
That does feel okay. I felt there on the side. You had it on the side. I felt a little.
Here.
Yes, that I can feel.
And then here, not as much. Can you feel anything at all?
Very faintly.
Alright, so I'm going to move to something that's a lot softer. Now, can you feel that this is soft?
Yes.
Can you feel here that that's soft?
Yes.
And here you feel that that's soft?
Yes.
Okay. So we're going to do the same thing. I want you to indicate if you can feel anything, okay?
I can feel up there faintly.
Okay. Alright. That's good. And back here at the bottom. Just like this. Your soft sensation is definitely diminished. You're not able really even to feel that at all. So I'm going to test something a lot more distinct that you should hopefully be able to feel. So kind of a Wartenberg wheel here. This is kind of a sharp wheel. It's not going to hurt you, but you should feel it. So I'm just going to apply a gentle pressure. Do you feel that that's sharp?
Yes.
And here, do you feel that that's sharp?
Yes.
Okay. So we're going to test the same thing. I'll have you close your eyes and just indicate if you can feel anything. So.
Yes, I can feel that, but not as sharp as in other areas.
Okay. So you do feel sensation, but it doesn't necessarily feel
yes,
sharp.
Sensation, yes. Yes, I feel sensation. Closer to the finger, I feel it more.
Okay, so up towards the finger you started to feel sharp. And here, does it feel any less sharp as I go across, or about the same?
About the same.
Does that feel sharp, or do you just feel something?
It does not feel super sharp to me.
And here, just at the center of the palm?
That's very muted.
Okay. But you do feel it?
I do.
If I come up like this, at any point does it feel less sharp or more sharp?
It feels more sharp as you get closer to the middle finger.
Okay. And if we go this way?
Very muted again, very muted.
I'm going to try this. I don't know that you'll be able to indicate, but I just want to try. I'm going to use this actually. So this will act as our soft. This is just a regular kind of cotton type of Q-tip. And then the same sharp. So this time I'm going to alternate. I want you to attempt to identify which you're feeling.
Okay.
So I'll start down here.
That's sharp. Soft. It feels similar to the sharp one, but it also feels like a Q-tip as well.
Okay. So very blunted.
Yes.
Okay. And is this sharp or soft?
It feels soft to me.
Sharp or soft?
That must be the Q-tip because I felt it even less.
Okay. So that was the Q-tip. So is this sharp or soft?
That's sharp.
Sharp or soft?
Soft.
Do you feel any difference between this and this here?
Yes. Sorry, I just felt like one of them really. The sharper one probably is what I was feeling.
Okay, so you probably felt this here?
Yes.
And not this.
No. If you're touching me, I'm not feeling it.
Okay. Alright, so I'm going to test with, let's see. This is very, very cold. It's been kept in the freezer, so
Okay.
it's maybe just a tad startling here, but you should feel that that's cold.
Yes.
And here's cold.
Yep.
And here's cold.
Mm-hmm.
And here's cold.
Yes.
Did all of that coldness feel about the same?
It did.
Okay. So I'm going to come up from the arm. I want you to tell me if at any point it starts to feel like a temperature difference. So if it feels colder here and then not quite as cold anywhere else, you just let me know.
Okay.
Here, does it still feel the same coldness?
Yes. Okay, now I'm feeling it a bit less.
different.
Yep. Yeah, it's.
Less.
Yes.
Can you feel
Yeah.
it here in your hand though?
I can feel it a bit. Yeah.
Okay. And then as we come up towards
Okay, now, yeah, I can feel it's cold
that
again.
feels cold.
Yeah.
And if I do here, does that feel cold?
That feels a bit warm, actually. It doesn't feel very cold.
And that here does feel cold?
That feels cold.
And here, does that feel cold?
Less cold.
Does that feel the same as this?
Similar.
Similar. Okay. And how about here? Does that feel cold?
Yes.
And here, does that feel cold?
No.
So temperature variation was slightly improved, but there's definitely a deficit in your overall sensation. The softer when you really weren't able to feel that whatsoever. Just gonna have a look here. So I do see a tad bit of discoloration along the thumb. Can you feel this here?
Yes.
Like you feel maybe pressure, but not
Yeah.
necessarily a distinct sensation.
Mm-hmm.
And then same on this side. Do you feel a pressure there?
Yeah.
And here you can't actually just feel me touching you.
Yeah, the fingers are fine.
But the palm.
Yeah. It's pretty numb. Very slightly.
Does it feel like, kind of like this would feel like just something is just barely touching you?
Yes, I was gonna say like similar to the Q-tip.
So even when I touched you with our most distinct, obviously you should feel that is very, very sharp. It's almost painful. You're feeling it kind of as if you would feel this.
Yeah.
Okay. Pinching you? Does that feel like a pinch, or does it just feel like something's touching you, or do you feel nothing at all?
More like a touch, yeah. Because it feels sort of like a little. Okay, that I felt.
Okay, sorry.
No, it didn't hurt. It didn't hurt.
Does that feel like
it's very soft.
Very soft.
Very soft.
Okay, so and you certainly, I'm sure, cannot tell whether or not 1 point or 2 points is touching you. Does that feel the same?
It feels the same to me.
Okay. So there are definitely some deficits of the hand. I'm just not quite sure if the injury took place to the nerve. So because you, a little bit of a click in there. Does that hurt at all?
No.
Okay. So I'm going to have you go ahead and relax your hand. I do feel quite a bit of deficit. There were several things that you're just not really able to perceive at all. So as far as your cranial nerve exam as a whole, all of your other senses are intact. So it doesn't appear as if you had any sort of, head injury, you didn't hit yourself, you didn't, fall on your head, there was no loss of consciousness, your sense of smell, sense of taste, all of that is intact. And your sensation for the most part is intact, except obviously for the impact sound. So I'm thinking you either damaged a nerve in your wrist that is then causing a blockage to the sensation and the neurological functioning of your hand, or there's some sort of skeletal inflammation. If the musculature and the ligaments around your skeletal system and the bones in your hand are swollen, it can just impede your ability to feel things. So if there's any sort of edema in there, then the swelling itself could be just kind of inhibiting your body's ability to feel something. So just picture if there's a layer of fluid in the hand, that could be why you're not feeling it. I'm just not quite sure which of the two is causing it. So at this point, I would like to get you in for an MRI of the wrist and the hand. So we'll probably do from elbow up just to see where exactly there's anything. If that's okay with you, are you comfortable with imaging?
Yes.
Okay, all right. So do you have availability to get that done today while you're here?
I think, yeah, I do.
Okay, it shouldn't take too long. Typically wait time is anywhere from 30 to 40 minutes. I do have to call down to radiology and see when they can get you in. So
that's fine.
Okay, so if you're comfortable with that, I will have you just kind of wait here. You can hang out in your room, and then I will call down and someone will come from transport and we'll take you down for imaging, and then we should get those results today actually, and I can go over it with you when they come.
Awesome. Thank you so much.
Of course. So I'll let you relax here. I will go take care of that, and I will come back in and update you with the wait time.
Okay, thank you.
Thank you, Maggie. Anywhere across the palm, does that change anywhere? Hey, what are you eating? Hey. No, sir. Sorry. Like I hear chewing sounds, and that's never good. So I am going to begin the sensory portion of the examination. So to start with, I'm just going to spray your hand with a touch of alcohol here. Just ensures we're not. I knew he wasn't going to like that. I'm so sorry.